Alphabet, Google just invested nearly $500 million into Oscar to change healthcare.
Well, John, you know I love the children's television workshop references. Oscar the Friendly Grouch. I'll learn my ABCs through Alphabet. Yeah, that sounds like a great episode.
We're talking about the leaders in technology revolutionizing healthcare. Don't you want to hear about that?
I'll give you a shot at it. Welcome to CareTalk, your monthly source for incisive debate about healthcare business and policy. I'm David Williams, president of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix.
All right, John. Survey says younger doctors favor single-payer health insurance. What do you think of that?
Well, let's be clear. With all of the attacks on Obamacare and all the attacks on coverage in general and the frittering away of some basic protections and potentially the loss of some pretty large ones, I think what the attacks on Obamacare have done is they've created this enormous wellspring of support for healthcare. In fact, Obamacare, according to Fox News, is actually more popular with the American public than the Trump tax cuts. And so what that has created is, particularly among the informed doctors, a desire to seek coverage, because if there's no coverage, care suffers and patients suffer. This is doctors speaking with their hearts and speaking with their minds. Coverage matters, otherwise patients suffer.
John, the amazing thing is the American Medical Association, they've been against universal coverage and socialized medicine since the 1930s, and their own doctors...
Whatever socialized medicine
whatever
means.
it may be.
Usually means that you're providing more coverage.
So the younger, physicians are really having a reversal of that, and it's partly what it's partly. I hesitate to say you're right, but let's say I'll acknowledge that people, because of Obamacare, realize, hey, everyone should have coverage. Now, what has changed though is the type of people going into doctors, into medicine in the first place. So back in our day, the people that wanted to make money and be independent, they would be the doctors.
You're demonizing the older doctors. That's
they
not
wish
fair.
they were hedge fund managers.
No,
that's where the money is now. So the younger docs are people that are more, socially aware, and they realize they're not going to have that much independence. They're not going to make that much money. They're going into medicine for the right reasons. And I'd rather have one of them take care of me than one of your hedge fund managers.
I think that most doctors really care about their patients. And what you're seeing is that this new generation of doctors is more dialed into what's going wrong right now politically. I think we're going to find that doctors are going to be great advocates for universal coverage for all. But the current headlines that are being touted run the risk of demonizing what's a really essential idea if we're going to have a healthcare system that works for everyone, which is that everybody needs affordable coverage at every level in every part of society.
No, that makes sense, John. And I do hope that it really is a force for universal coverage, and that we actually give some of the initiatives in the private sector an opportunity to go beyond kind of last generation's answer, a sort of a European single-payer socialist kind of approach.
Speaking of a new generation, what do you make of the increased investment that Google just made in Oscar, sort of the new age health insurance product that's only up in a couple of states, but really has sort of a technology and a design orientation? What do you mean? It's almost $400 million they put into it.
So it seems like Google's been backing this company for a while. I wonder, the cynic in me, and yes, there is one, wonders if it has anything to do with the fact that Jared Kushner's brother, Josh Kushner, is a co-founder, and this may be a way to funnel funds in there. I think it's...
Oh, sure. So this is the dark plot of one White House brother attacking Obamacare and the other one actually making money by trying to grow it. That makes absolutely no sense.
Okay, well, thanks, John. So the idea of the use of technology in healthcare, I think that's great. There's obviously a play for Google in that. Oscar, on its own website, admits that as a health insurer, there's a limit to what they can do to really change healthcare. So I'm curious about, what do you see as how this is really going to be any kind of fundamental change besides just a playground for Alphabet?
I don't know. Well, everything's a playground for Alphabet when you've got infinite money and infinite leverage. But I think that what's really exciting about Oscar is the design mentality of looking for a product from a technology perspective that's like any other product that succeeds in technology. That's simple, it's user-friendly, it's transparent, it's fast, and it's practical, and it's low cost. It sucks costs out of the system. That's not the way healthcare is. Almost the exact opposite. And to have a health insurance company, which is a pretty complicated thing to do, take that orientation and make access to doctors by phone fast and easy, great user tools, pay for wellness, invest in wellness, and also have sort of an informed choice of high quality doctors, even though they're using narrow networks. I think it's really exciting. They're not going to change all of healthcare, but they really could create a new standard for how you design healthcare products and a healthcare interface. I think it's super exciting.
So John, after a little self-reflection, and not want to be a complete cynic here, so here's, on the optimist in me says, a lot of times these
There's an optimist?
Yep, these technology approaches within healthcare, great. They're for people that are young and healthy and sort of don't really need them. But I did notice that Oscar is moving into Medicare Advantage, which is actually an age range where people actually need healthcare. And it's interesting that they're considering technology in that group. Any insights into that?
Well, I just think it's super practical. I mean, what you're going to find, what's sort of exciting about that is that you've got a CMS leadership that actually manage the Medicare and Medicaid program in DC, looking to create more flexibility of how you can run a Medicare plan right at a time when a truly innovative plan might be able to bring flexibility that matters to seniors, because seniors are looking for simplicity, easy user interface, more transparency on quality and service. I mean, I think that almost 40% of all of the appointments made by Oscar members are made through Oscar's either website or their concierge team. If you think about my mom in her 80s and how much easier it would be if she could have one source to actually have all of her appointments set up, they're bringing a real service mentality, augmenting technology. I think it's super exciting. We don't know, but it's exactly the kind of innovation that could really matter to a graying America.
So John, we talk about drug prices on pretty much every episode. I don't see a real reason to stop here. So, CVS, which used to be not until pretty recently just a drugstore and they'd sell all the usual stuff, including, cigarettes and all that, more recently moved into healthcare and is really trying to influence things. Now I noticed that on their PBM side, they're actually...
It's really unfair for you to take the only leading retailer that took a stand against tobacco and mention that. They've actually been a real they've repositioned themselves and walked their talk around wellness and health.
All right. I'm going there, John. So anyway, they've decided on their PBM side that they're going to give their customers the option of excluding really high price but low value drugs, biotech drugs, from the formularies. Does that mean anything, or is it just a headline grabber?
It is a little bit of a Captain Obvious point, so thanks for bringing it up. But the reality is
that Lieutenant Subtle.
The reality is that most employers and health plans have not been willing to take on the bullies from pharma around taking drugs off the formulary. Our own health plans and employers aren't as strong-willed and as thoughtful as most other industrialized countries are to force low-value drugs off the formulary. I applaud CVS for taking a first step for at least illustrating how dumb a practice it is to keep bad expensive drugs or ineffective expensive drugs on formulary. It's a modest first step, but it's a first step that matters, and I'm excited about it.
So John, as long as you tag me with the Captain Obvious label, I'll give you another one. So an economist back in the 70s and 80s, Herb Stein, used to say that if something cannot go on forever, it will stop. And I think
that's a profound.
See, I've already, that has no impact on me, John, because you already said that about my previous point. But in this case, we haven't known, Howard, how is the rise of drug prices going to stop? We know it will stop. We don't know how.
No,
I think the CVS, no, we do. I think the CVS example is one example, and I actually think that the Trump blueprint is helping here because it kind of demonizes the PBMs, and PBM is trying to show, no, we can actually do something about drug prices.
That's a really complicated, bad argument, but let me just take it apart. Drug prices are going to go up because there's extraordinary new drugs that are being developed that are going to be expensive, that are going to save lives. So some of that's going to happen.
All right.
We need to slow the rate of increase, and we need to get bad, expensive drugs off the market, and we need to negotiate fair prices. But drug prices are going to continue to go up, and this blueprint is fraudulent. It is not going to have any.
Well, just because it was written by a fraudster doesn't mean it's fraudulent.
It was written.
Michael Cohen, I think, had his hand in it, right? Novartis got their money's worth there.
Pharma comes in for a lot of action, but there is some a heroic intent on the part of the president, and I think
heroic intent.
CMS, but it hasn't been matched
Yeah.
by a real plan and real plans. But it does meet and speak to a real concern that folks have that they can't afford the drugs they need. And at some point, that will slow down the drug price appreciation. But that's about the best you're going to get.
All right. What else you got more for me, John? Come on.
Well, I guess one of the things that still worries me, and I've been trying to dig into it, is do you think we're making any progress on the opioid crisis? Because it's still killing 115 people a day in the U.S.
You know, there's so many other crazy headlines that you don't read that much about the opioid crisis, but it's no less of a problem. In fact, it might even be getting worse. So I saw the other day that something like half of all the opioids that are on the street have fentanyl mixed in, which is deadly.
Much more dangerous.
Yeah,
much more dangerous cocktail.
A couple of interesting research pieces out lately. One about physicians, and they found out that if you tell a physician that they prescribed a drug to somebody who had an overdose, it makes only a modest change in their prescribing behavior. And then another one that I thought was important, which was characterizing these opioid deaths, which have ruled accidents, but saying a lot of them are actually probably suicides. And if anything, it understates the mental health component of the opioid epidemic and mental health problems crisis in general. So those are a couple new things.
But if I'm going to agree with you on one thing, it's that we really have to spend more time prioritizing this really ongoing social disease, the burden. There's just too many people dying, and it's a hard problem, but it's a problem where we're going to have to deal with doctors and law enforcement and CMS and the pharma supply chain and PBMs. I actually think that PBMs and health insurers have taken heroic first steps by trying to radically restrict access to this. But we've got a lot of mileage, a lot of things to do, a lot of tactics that have to be employed. But the most important thing is not to ignore these real victims of a whole series of mistakes that they are mistakes that we can solve for right now, and we just can't forget about that crisis.
I mean, John, to go back to your point about fentanyl, about how dangerous it is, after the states found out they can't get these drugs for lethal injection for executions from Europe, Nebraska started to use fentanyl for lethal injection. What does that tell you?
Well, it just underscores how easy it is to access deadly substances. And I think again, there's we just can't. We've got to keep the public focus on on this hard problem, which we actually can solve. And there are certain communities that are starting to solve it, but not to hide from it, because I think the fact that this emerged, it has spiked recently, but it's been emerging as a real burden for particularly aging industrial parts of the country, but we got to take it on as a real priority, because we can solve it. We absolutely can.
So, John, we've hit on some pretty important topics, some good conversation, but this is a little bit depressing. Do you think we can lighten things up a little bit in the lightning round?
Always.
John, these lightning round questions are supposed to be really quick, but this is such a funny one. We're going to spend a little more time with it, all right? Here's my question.
Shoot.
Did Chris Collins give you any stock tips recently?
Chris Collins, the recently indicted congressman who was the first congressman to endorse Donald Trump, and maybe the first Trump endorser to go to jail. He was recently indicted for insider trading, and no, I have no knowledge, nor have I ever met or had got any stock tips from the soon to be criminalized Congressman Collins.
Your denials don't ring true. John, he's investing in this innate immunotherapeutics over in Australia, and apparently what happened is the results of the trial came out, and he said, wow, how could these results even be possible? Which shows he doesn't know too much about drug trials either, because it usually doesn't work.
It's a little crazy that we allow our congresspeople to trade stocks. The good news is he was already precluded from trading stock because he was under investigation from the ethics committee for even being involved in the company. He was actually on the board of the company. I think we really have to be clear about kind of commercial versus service, and he was clearly confused. But this is no knowledge of Chris Collins. He must be a pal of yours.
All right.
David, you always present yourself as an expert. So what's up with IBM Watson, Mr. Genius?
Yeah. Well, John, I guess you'd have to say that they're in jeopardy. because what's happened is what they've shown is that Watson is really a loser. I mean, it's a winner when it comes to being on TV and playing against some bonehead, but when it comes to trying to find...
talking about Bob Dylan?
Well, when it tries to find cancer, it's a loser because it's dealing with garbage in, garbage out. I think Watson's days are numbered, if not over.
I think that Watson is in the early stages. A lot of technologies get oversold initially. Obviously, this was oversold by IBM as a way to create its positioning around artificial intelligence, and it turns out there was more artificial than intelligence here. But you wait. I actually think that IBM will get its act together, and Watson's going to be back.
Now, John, with all that CMS has on its plate, why are they trying to stop home health aides from unionizing?
It's a really crazy idea. I mean, this is the new CMS warning or finding that they're going to restrict the ability of home health agencies or state payers to pay independent home health workers as a way to prevent them from unionizing. I just think it's an unforced error on the part of CMS, who have a lot of other great priorities and are doing some really good things. To take away the rights of folks who are some of our poorest paid caregivers, it just seems unfair to me.
John, I think federal government just given a taste of the whip before they deport a lot of these people who are immigrants.
It's just unfair. So David, with all of our serious talk, I think we had to end on sort of a more human note. It's the end of the summer. Did you see any great movies? What's your favorite summer movie?
John, my favorite of the summer was one I just saw, which was Crazy Rich Asians, because it was a lot of fun, and also no one's talking about the cost of healthcare in there, so that's nice. Maybe, I mean, Singapore actually has an interesting healthcare system.
Twist it into a healthcare.
Instead they showed, like the market stalls where you can get these great foods and all that, so it probably was more fun because they didn't talk about healthcare. How about you, John? Anything good?
Deadpool 2. Brilliantly written, crazy, stupid humor, my kind of movie.
Well, that's it for this month's edition of CareTalk. If you like what you saw or what you heard, make sure to subscribe using your favorite service. I'm David Williams, President of Health Business Group.
And I'm John Driscoll, the CEO of CareCentrix. Thanks for watching.